Welcome back to the Best PT podcast. This is episode 2.16, talking about musculoskeletal pharmacology. We'll talk about 4 different types of pharmacology related to the musculoskeletal system. We'll start with non-opioid agents. The purpose of these drugs is to provide analgesia, anti-inflammatory effects, and antipyretic effects, so to reduce fever. These work by reducing prostaglandin formation, which decreases the inflammatory process. They can also decrease uterine contractions, lower fevers, and reduce pain. Side effects include nausea, vomiting, vertigo, abdominal pain, GI distress, and bleeding, especially with overuse, ulcer formation, and Ray's syndrome, which occurs in children with aspirin. PT should be aware of patients using non-opioids because of masked pain, as well as complaints of stomach pain. Examples include Tylenol, NSAIDs, such as ibuprofen, aspirin, Aleve, Advil, and Celebrex. Opioids provide analgesia for acute severe pain. They stimulate opioid receptors within the central nervous system to help with pain, dependency, or withdrawal. Side effects include mood swings, sedation, confusion, vertigo, cognitive impairments, orthostatic hypotension, constipation, incoordination, physical dependence, tolerance, and death due to overdose. Examples include morphine, Demerol, OxyContin, which is a brand name, oxycodone, the generic name, fentanyl, and codeine. Glucocorticoid agents, so corticosteroids, they provide a hormonal anti-inflammatory effect as well as metabolic effects and vasoconstriction. Side effects include muscle atrophy, GI distress, glaucoma, drug-induced Cushing syndrome, osteoporosis, mood changes, hypertension, and fatigue. Examples include hydrocortisone, cortisol, prednisone, prednisolone, methylprednisolone, dexamethasone, and Nasonex. And finally, anti-rheumatic agents are also known as disease-modifying anti-rheumatic agents, or DMARDs. These slow or stop the progress of rheumatic disease. If used early enough in the disease process, they work by inducing remission of the disease. Side effects include nausea, joint pain, swelling, toxicity, GI distress, sore throat, fever, liver damage, hair loss, sepsis, and retinal damage. Physical therapists should know that DMARDs have a very high risk of toxicity. Examples include methotrexate, chloroquine, and tumor necrosis factor inhibitors. That's it for musculoskeletal pharmacology. As always, the outline will be in the show notes. The next episode will be episode 2.17, talking about orthotics. Thank you for joining me.